Ruxolitinib 1.5 topical cream is used to treat certain skin conditions such as eczema, atopic dermatitis, and vitiligo. Eczema causes red, irritated, and itchy skin, while vitiligo is a condition where the immune system attacks skin cells that make the color in your skin. This cream weakens the skin's defense system, which can help relieve symptoms of these skin conditions. Ruxolitinib belongs to a class of drugs known as kinase inhibitors. The recommended daily dosage and optimal timing for using this cream should be determined by your healthcare provider. Before using ruxolitinib, make sure to read the medication guide provided by your pharmacist. Wash your hands with soap and water before applying this cream to the affected areas of your skin. Your doctor will typically recommend applying a thin layer twice daily and gently rubbing it in. Remember to wash your hands after applying the cream, unless your hands are being treated. If your doctor suggests using a moisturizer, apply it after the medication. It's important to only use this cream on the skin and avoid getting it in your eyes, nose, or mouth. If this happens, flush the area with plenty of water. Also, do not apply the cream to open wounds or infected areas, unless directed by your doctor. Follow your doctor's instructions carefully and do not use more than the recommended amount of medication. For eczema, your doctor may advise you to stop using the cream once your symptoms have cleared and to start using it again if they reappear. Make sure to consult your doctor for specific details. If you are using this medication for eczema, do not exceed 60 grams per week, or 100 grams every 2 weeks, unless directed by your doctor. If your condition does not improve after 8 weeks of treatment for eczema or 24 weeks of treatment for vitiligo, or if it gets worse, be sure to inform your doctor. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as signs of anemia, like unusual tiredness or pale skin, or easy bleeding/bruising. Although rare, a serious allergic reaction may occur. Seek medical help right away if you notice symptoms like rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects. If you notice any other effects, it's best to contact your doctor or pharmacist. In terms of reporting side effects, in the US you can call your doctor for medical advice, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice, or report side effects to Health Canada at 1-866-234-2345. When using ruxolitinib 1.5 topical cream, it's important to be aware that it may lower your ability to fight infections, which can make you more susceptible to serious infections or worsen any existing infections. Some people who have taken ruxolitinib orally have experienced very serious, possibly fatal, infections such as fungal infections, tuberculosis, and herpes zoster. If you experience any signs of infection, such as a persistent sore throat, cough, fever, chills, unusual sweating, or a painful skin rash or blisters, it's essential to inform your doctor right away. It's also important to note that there have been reports of cancers, including skin cancer, and blood clots in people using ruxolitinib cream. Additionally, a similar medication to ruxolitinib, when taken orally, has been associated with serious, potentially fatal side effects, including heart problems, blood clots, and cancer such as lymphoma. Therefore, it's crucial to inform your doctor or pharmacist if you have a history of heart disease, stroke, cancer, or any risk factors for heart disease, such as high blood pressure, diabetes, previous blood clots, high cholesterol, smoking, or a history of smoking. Patients who are 50 years of age or older may be at an increased risk for heart problems or blood clots, so it's important to discuss the risks and benefits of treatment with your doctor. If you experience symptoms such as shortness of breath, rapid breathing, chest, jaw, or left arm pain, unusual sweating, sudden dizziness, fainting, pain, swelling, or warmth in the groin or calf, sudden or severe headaches, trouble speaking, or weakness on one side of the body, it's essential to seek medical help immediately. Before using ruxolitinib 1.5 topical cream, it's important to talk to your doctor or pharmacist about any allergies you may have. This cream may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your healthcare provider. It's also important to inform your doctor or pharmacist about your medical history, especially if you have had or currently have cancer, infections such as tuberculosis or hepatitis B and C, or a weakened immune system. If you are planning to have surgery, make sure to disclose all the medications and products you are using. It's important to limit your time in the sun while using this medication, as it may increase your risk of getting skin cancer. Avoid tanning booths and sun lamps, and make sure to use sunscreen and wear protective clothing when outdoors. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if this medication passes into breast milk and may pose a risk to the infant. When using Ruxolitinib 1.5% topical cream, it is important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It is important not to start, stop, or change the dosage of any medicines without your doctor's approval to ensure the safe and effective use of Ruxolitinib 1.5% topical cream. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can contact your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to remember not to share this medication with others. Your doctor may want to do some lab or medical tests, such as complete blood counts, cholesterol/triglyceride levels, and skin exams while you are using this medication. Be sure to keep all your medical and lab appointments and consult your doctor for more details. This medication has been prescribed specifically for your current condition, so it's important not to use it later for another skin condition unless your doctor tells you to. If you have eczema, it's a good idea to talk to your doctor about other ways to manage your eczema, such as using moisturizers and taking shorter baths or showers. These can be helpful in addition to using the Ruxolitinib 1.5% topical cream. If you happen to forget to use the cream at the scheduled time, apply it as soon as you remember. However, if it's almost time for the next dose, just skip the missed one and continue with your regular schedule. It's important not to use a double dose to make up for the missed one. Remember to store Ruxolitinib 1.5% topical cream at room temperature and out of reach of children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it into a drain unless instructed to do so. When this product is expired or no longer needed, be sure to properly discard it. It's best to consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.